How much protein should we eat for longevity? If you want a really long and healthy life, what is the ideal amount of protein to intake? If we look at the RDA for men 19 to 50, it is 56 grams a day. Now, I don't go by the RDA for a lot of things, but they think they might be kind of in the ballpark on this one. So how much do men consume in America? Well, double that amount, over 100 grams a day. So would decreasing the protein intake have an effect on your health? Let's look at the studies. Here's one where they decreased the consumption of branched-chain amino acids or proteins, and they found improvements in metabolic health. And they went from 111 grams a day, which is quite a bit, down to 63. Now 63 is still above the RDA, and what they found was that it increased something called FGF21. That is the longevity hormone. So how much did cutting that protein down to still a fairly significant amount make it go up? A lot. It went up double. You don't double your longevity hormone when you cut the protein down. And that's not all. They also found in the study that when they decreased the protein, the group consuming less protein actually ate 300 calories more, but lost 2 pounds more body fat. And that is because, in my opinion, when we decrease protein, we're bumping up FGF21, which does some great things to your body. Here's what the summary of this article said. Who among us hasn't fantasized about a diet that allows ingesting a surfeit of calories that are burned off effortlessly by ramping up energy expenditure? When you decrease protein, you increase the liver's production of FGF21. Now, if you're on a high protein diet, on the other hand, the liver produces less of this longevity hormone. Another study on decreasing branched-chain amino acids, our human clinical trial data suggests that even a quite modest reduction in protein intake may have a significant benefit. In this study, they went down to 73 grams of protein a day. Again, we're 20 more grams than the RDA, and did that affect FGF21? How about a 600% increase in 1 week? That's tremendous. Anything else happen besides boosting FGF21? Well, they found an improvement in insulin sensitivity, which means your insulin that your body's producing works better. The cells are more sensitive to the insulin, so your pancreas produces less, which is definitely what we want. Evidence suggests that a lower protein intake is positively associated with increased survival, health, insulin sensitivity, and there's lots more evidence that is continuing to mount. How about protein and longevity? Well, if you look at countries around the world that live the longest, the Okinawans are right up there at the top of the list, and about 10% of their diet is protein, and the rest is carbohydrates and a little bit of fat. One of the amino acids that appears to be most significant to restrict is called methionine. And where do you get methionine? It comes mainly from animal protein. So it appears to be one of the most significant things that we should be looking at restricting if you want longevity. Additionally, methionine restriction stimulates the synthesis of FGF21. It is the most important mediator of metabolic reprogramming in methionine restriction. So what foods are highest in methionine? Beef, poultry, lamb, veal, game, seafood, pork, dairy, nuts and seeds. Here we're getting down less and less, but the animal products definitely have the most. So in addition to helping us lose weight and live longer, any other benefits of boosting FGF21? Well, how about protecting you from cancer, autoimmune disease, obesity, and diabetes? If you look at diets of people who are vegans, they don't consume animal proteins, they have a favorable diet for lowering your risk of metabolic syndrome, diabetes, and obesity. And also it appears to impact their vascular health, their heart and blood vessels. Dr. Eiselstein is one of the doctors who I've been following for decades now, and he does a lot of research on patients with heart disease, and he has seen heart disease halted and reversed. And he uses a low protein diet, low fat diet, high in good carbs, loads them up on the good carbs. And he also uses statin drugs, which I wouldn't suggest. But he says the benefits that he gets on patients is likely not from the statin drugs, because if you just put people on statin drugs, you don't see the reversal of artery disease like we do when you eat lots of good vegetables. Now, the first patient I treated for a blocked coronary artery was Roy, and that was in 1990. He was scheduled for a bypass. He refused to do it. Instead of doing that, came here, and he had a blocked coronary artery very similar to this. 1 year later, he went from not being able to walk a block without getting chest pain and sitting down to elk hunting in Colorado for a week with his grandson. He lost weight, improved his vascular health. When he returned from that trip, his cardiologist insisted he do another angiogram, and they found the blood vessel had opened up similar to this. And this is me and Roy 28 years after that happened. So back to Dr. Eiselstein. He, 2 years after I did that with Roy, which was unheard of, reversing artery disease, he started doing imaging studies like this and showed that these changes or openings in the artery begin after 3 weeks of following a healthy eating plan. And even the larger blood vessels start reversing and opening up in months or years. The conclusions were 82% of the experimental group put on this healthy diet had average changes toward regression. They did an interesting follow-up study with this group. 12 years later, they looked at the people, and the ones that were continuing to follow a healthy eating plan had no coronary events, no interventions. Basically, he says he made these people heart attack proof. Another study on methionine. This is restricting methionine, so animal proteins, and they looked at FGF21 to see what happened and found that plasma levels were markedly higher in people that weren't eating meat compared to the meat-eating group after 4 days. So you get a boost in this longevity hormone in 4 days. They had a 232% increase. So here's my suggestions for you. If you want to live a long and healthy life, do not overconsume protein. And the easiest way to overconsume protein is eating too much meat. Now, in the 7 Systems Plan, we teach you the right amounts to eat, but in general, we want to decrease our animal protein. You can still have some, but don't go crazy, and increase our plant proteins. In my opinion, 60 to 80 grams of protein a day appears to be the sweet spot for health and longevity. More protein may be necessary if you're trying to build muscle. So we do need extra muscle, extra protein if we're trying to build muscle mass. And if you're trying to build muscle mass, you're not going to do it by just taking in protein. You have to do exercise. You have to stress the muscles. One last thought. In the elderly, we want to make sure they're getting enough protein. So when we're young, we tend to get in too much. As we get older, we tend to maybe not get enough. That's why they lose muscle and become frail. Consume the right amount of protein to preserve your health.